Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video, I'd like to kind of expand on the neck pain we talked about last week in regards to the possibility of cerebral hypoperfusion. Cerebral meaning brain. Perfusion is the flow of liquid to a body organ. So hypo would be reduce liquid flow to the organ, or hyper would be too much. So this week's handout actually talks about the hypoperfusion to the cerebellum, meaning if you have neck pain or neck disorder, subluxations, where the joints aren't moving properly, it can actually reduce blood flow to your brain, which can lead to cell destruction and cell death, which we don't want. And they quote one of the studies where JMPT talked about where they did CT. It was a specialized CT, and they called it a SPEC, which stands for Single Photon Emission Computed Tomography. And look at this week's handout, which is going to be on Facebook and everywhere, and you can actually read in detail. But they also had these patients fill out a subjective questionnaire called a Neck Disability Index. And they rated it in mild, moderate, and severe. So those are the three levels of neck pain. And what they found under this SPEC test, where they tested the amount of blood flow to the brain, that for mild people, there was no effect as far as blood flow to the brain. For moderate pain, they found 20 to 35% decrease in blood flow or cerebral hypoperfusion to the brain. 20 to 35%. So imagine having that much reduced blood flow, which remember, your blood carries oxygen and other nutrients to your brain and all the cells in your body. So you're looking at 20 to 35% reduction with just moderate neck pain. Severe neck pain, the SPEC test showed 30 to 45% decrease. 30 to 45%. Now, in the area of the brain they found this in was in the parietal and frontal lobe, which these lobes are going to, the frontal lobe talks about controlling dopamine release to the body, which is going to have a major effect. And also the parietal is for sensory and spatial feeling of where things are at, because people, balance and things like that. So it's a fantastic article. I hope you look at it, and I actually wanted to talk about it because I'm not sure how many people are clicking on that. I know the videos get a lot more visibility because Google lets me know that. So just if you are someone you know or love or care for is having neck pain, we've just been seeing so much of it. People are stressed, they're sitting in front of their monitor all day and they're getting a sore neck and they're not getting up from their desk and moving around, and people are so busy they're not finding time to exercise and to take better care of themselves. But remember, this is the only body you have. You need to take care of it, because without it, where are you going to live? So have a great week, and we'll see you next time.